The prostate cancer journey. When you find this useful, please like so we can help more people. It is the second most common cancer in men worldwide, with an estimated 1 in 6 men being diagnosed with prostate cancer in their lifetime. Vietnam veterans with prostate cancer are automatically presumed to have been exposed to Agent Orange and are entitled to VA benefits. In this video, we will discuss the symptoms, diagnosis, treatment options, and coping strategies for living with prostate cancer. We will also provide information on support resources and the importance of early detection and screening. It's important to note that early detection and treatment can greatly improve the prognosis and survival rates for prostate cancer. Prostate cancer often has no symptoms in its early stages and sometimes may not show anything even in severe cases like mine. As it progresses, it can cause a variety of symptoms such as difficulty urinating, weak or interrupted flow of urine, blood in the urine or semen, and pain or discomfort in the pelvic area. Other symptoms may include erectile dysfunction, frequent urination, and pain during ejaculation. It's important to note that these symptoms can also be caused by other conditions, so it's crucial to see a healthcare professional for a proper diagnosis. The diagnostic process for prostate cancer typically begins with a prostate-specific antigen, PSA, test. A simple blood test, which measures the level of PSA in the blood. Elevated PSA levels can be a sign of prostate cancer, but it's not a definitive diagnosis. A biopsy may be recommended if the PSA level is high or if there is an abnormality on a digital rectal exam. A biopsy is a procedure where small samples of tissue are taken from the prostate and examined under a microscope. It's important to discuss with your healthcare provider about your symptoms, risk factors, and the best diagnostic plan for you. Early detection is key for better treatment options and outcomes. When it comes to treating prostate cancer, there are several options available, each with its own set of benefits and risks. All these are developed into fully explained topics in our follow-up video. Surgery, such as radical prostatectomy, involves removing the entire prostate gland and some surrounding tissue. This is typically recommended for men with early-stage prostate cancer. Radiation therapy, including external beam radiation and brachytherapy, uses high-energy beams to kill cancer cells. This is typically recommended for men with more advanced prostate cancer or those who are not candidates for surgery. Hormone therapy, which is also known as androgen deprivation therapy, lowers the levels of the male hormone testosterone in the body. This can slow or stop the growth of prostate cancer cells. This is typically recommended for men with advanced prostate cancer or for those who have a recurrence after initial treatment. Wait and watch. You have several different health problems already and recognize that your quality of life, which may already be short, will not likely be better with an intervention. It's important to discuss with your healthcare provider about the best treatment plan for you based on your individual case, your preferences and values, and the stage and grade of your cancer. The Gleason score ranges from 2 to 10, with higher numbers indicating a more aggressive cancer. The score is determined by adding together the two most common patterns of cancer seen in the biopsy samples. Each pattern is given a grade from 1 to 5, with grade 1 indicating the least aggressive and grade 5 indicating the most aggressive cancer. In my case, the most common pattern of cancer seen was grade 5 and the second most common pattern is grade 4. The Gleason score would be 9, 5 plus 4. A Gleason score of 9 is considered to be high-grade cancer. This score is used to help determine the stage and aggressiveness of cancer and to help guide treatment decisions. Being diagnosed with prostate cancer can be a difficult and overwhelming experience, both emotionally and practically. It's important to take the time to process the diagnosis and to seek support from loved ones, friends, and healthcare professionals. Treatment for prostate cancer can cause a variety of side effects, including fatigue, impotence, and incontinence. It's important to discuss these potential side effects with your healthcare provider and to work with them to manage them as best as possible. Adjusting to changes in your life. Living with prostate cancer can also mean making adjustments to your daily routine. This may include changes to your work schedule, changes in your physical activity levels, your love life, and changes in your diet and nutrition. It's important to make these changes in consultation with your healthcare provider and partner to ensure that you are getting the support you need. It's important to keep in mind that everyone's journey is different and that it's okay to take the time you need to process your diagnosis and make the necessary adjustments. There are support groups, counseling, and online communities that can provide you with the emotional and practical support you will need. Support is crucial for both patients and their families when dealing with a diagnosis of prostate cancer. Patients may be struggling with their diagnosis and treatment, and their families may also be struggling with the emotional and practical aspects of the disease. Support groups are a great way for patients and their families to connect with others who are going through a similar experience. These groups can provide a safe space for people to share their thoughts, feelings and experiences, and to gain valuable insights and advice from others. Counseling can also be a valuable resource for patients and families. A counselor can help patients and families to process their emotions, cope with the practical aspects of the disease, and navigate the healthcare system. Online communities are also a great resource for patients and families. These communities can provide a sense of connection and support, even when people are physically apart. It's important to note that everyone's needs are different, and it's essential to find the right support that works for you and your loved ones. Your healthcare team can provide you with resources and guide you in the right direction. The prognosis and survival rates for prostate cancer can vary widely depending on a number of factors, including the stage and grade of cancer, the patient's age, and overall health. Prognosis refers to the expected outcome of a disease, and it can be influenced by a variety of factors. The stage and grade of cancer, as well as the patient's age and overall health, are all important factors that can influence the prognosis. Survival rates are often expressed as a percentage, and they can provide a general idea of the likelihood of surviving a particular disease. For prostate cancer, the 5-year survival rate for localized cancer is nearly 100%. However, for advanced stages, the rate can be around 30%. The stage and grade of cancer, as well as the patient's age and overall health, are all important factors that can influence the prognosis and survival rates. The patient's adherence to the treatment plan and the patient's response to the treatment are also important factors. It's important to remember that survival rates are only estimates and that everyone's experience with prostate cancer is unique. It's essential to discuss your individual case with your healthcare team to understand your specific prognosis and survival rate. Prostate cancer is a common disease, but early detection and screening can greatly improve the outcome. Prostate cancer often has no symptoms in its early stages, which is why early detection is crucial. When prostate cancer is detected early, it is more likely to be treated successfully. Screening tests such as the PSA test and digital rectal exam, DRE, are used to detect prostate cancer. The PSA test measures the level of prostate-specific antigen, PSA, in the blood, while the DRE involves a physical examination of the prostate. While it's not possible to completely prevent prostate cancer, there are some things that can be done to reduce the risk of developing the disease. Eating a healthy diet that's low in red meat and high in fruits and vegetables. Maintaining a healthy weight. Exercising regularly. Not smoking. Limiting alcohol consumption. It's important to talk to your healthcare provider about your risk factors and the best screening plan for you. It's also important to remember that a negative screening test does not guarantee that you do not have cancer. You should be aware of any symptoms that may appear and report them to your doctor. Prostate cancer is a common disease that affects men worldwide. It's important to be aware of the symptoms. The importance of early detection and screening. Learn about the available treatment options. In this video, we discuss the symptoms and diagnosis, including the use of and importance of the PSA test. The treatment options available, such as surgery, radiation therapy, and hormone therapy. Coping with the diagnosis, including dealing with the side effects of treatment. Adjusting to changes in your life, and support for patients and families, including support groups. Counseling, online communities, the prognosis and survival rates, and prevention and screening. It's important to remember that everyone's journey is different. It's essential to find the right support that works for you and your loved ones. Your healthcare team can provide you with additional resources and guide you in the right direction. There are many resources available for those who want to learn more about prostate cancer, such as the American Cancer Society, the National Cancer Institute, our YouTube channel 2RNs, hosting more than 48 prostate cancer videos. These organizations provide information on the latest research, treatment options, and support resources. It's essential to talk to your doctor about your risk factors and any concerns you may have. Early detection and treatment can greatly improve the prognosis and survival rates for prostate cancer. We hope this helps you. Ellen and Michael Moriarty, 2 RNs.